Welcome back. Time for a new installment of Healthy Living. Dr. Stephen Kozusko is here to talk with us about breast and skin cancer reconstructive surgeries. Thank you so much for coming through.
Thank you for having me.
So for patients undergoing treatment for breast or skin cancer, how can reconstructive surgery support both physical healing and emotional recovery?
Great. Both of those aspects are very critical. The physical is accomplished through technique and meticulous training. I've spent 9 years training to learn all the ways to reconstruct both breast cancer and skin cancer, including time at St. Jude's in Memphis and the East Coast affiliation for MD Anderson Cancer Center at Cooper University. And that lends itself towards the physical aspect, but the more important part for me is the emotional. And to accomplish that, it's about restoring a sense of dignity and control to a patient in a diagnosis that often jeopardizes that.
Sure.
So that to me is a critical part.
Yeah, fascinating. So talk to me about reconstructive options that are available for people after breast cancer surgery or skin cancer removal, and how do you help those patients choose the approach that's right for them?
Right. So we have something special here at Northern Light in our plastic surgery division. We have the state of Maine's only program for what is called autologous breast reconstruction. Another term for that is a deep flap, deep inferior epigastric perforator flap. All this terminology means is that we offer a way to reconstruct breast cancer using your own body. Historically, tissue expanders, implants were the mainstay of reconstruction, but we have another option that is independent of tissue expanders and implants. Employs some special microsurgical technique, but it gives women a full complement of options to deal with their diagnosis and to help them along their journey. We're supported, we have 2 board-certified plastic surgeons, myself and Dr. Bagdasarian, and 3 board-certified physician assistants. And this program is fully supported by the institution with administrative support, including Ava Collins, surgical department support with Brad Waddell, and a full complement of nurses and other personnel to have this program for anyone in the state of Maine. Historically, patients were going down to Boston for this reconstruction. Yeah. We now keep it here and offer to all the patients. So that's one thing really special we have. But we have various ways to approach any type of skin cancer, anywhere on the body, and any breast cancer diagnosis.
How do you help patients understand the timing of reconstruction, including immediate versus delayed options during breast or skin cancer treatments?
So we sit down usually and have up to an hour-long consultation visit, and sometimes a second appointment if the patient desires or has further questions. Oftentimes this could be a jarring diagnosis, and I like to ensure that I have at least 2 visits available to a patient to help them on their journey. And we go over whether or not they're a candidate for immediate, delayed. Regardless, there are usually multiple ways to approach these diagnoses. The patient, for me, it's important to know, for them to know that we don't have to do one thing one way and on one timeline. Again, dignity and control, and having multiple ways to reconstruct things gives that back to the patient.
What should patients expect during a surgery consultation after a cancer diagnosis, and how do you help them feel informed and supported throughout that process?
The most important thing for me is ensuring that the patient knows they're not alone. They don't have to go through this diagnosis and treatment without support, without care, without somebody to call when they feel they don't know the answers to their questions. So that is the biggest emphasis of what I try to bring to the patient during their visit. I always thank them for trusting me to take care of them, because oftentimes there's the thought that the patient needs the physician, but I think in serving this community, the physician equally needs the patient. And so those are types of relationships I try to build through these cancer journeys.
Sure, it's a difficult time. You need to have trust, and that's probably one of the most important parts of it. What should they do? Who should they contact? What do they need to do, and how do they get in touch?
Yeah, so any woman with breast cancer, any patient with skin cancer should call Northern Light Plastic and Hand Surgery at Eastern Maine Medical Center. We will treat women with breast cancer that have it acutely, working through our breast oncology team. We will also treat women that have had breast cancer years ago. Many women think there are no options available to them. They may have had a failed reconstruction with an expander or an implant. They may have undergone radiation therapy and been told there's nothing further. But we can offer something at any stage of the journey. Immediately, years later, we can take out implants. We can use your own tissue to replace implants. There are so many options available now. So any woman that is looking for care now or in the future can call the office. And in regards to skin cancer, we have now the full capacity to biopsy, excise, and reconstruct skin cancer. So anybody with a concerning lesion, if they're having trouble getting access to care, they can't find a dermatologist, they don't have a primary care provider, we're able to see those patients as well.
Fascinating stuff. All right, thank you so much for coming through. If you want more information or to track more down, northernlighthealth.org is the place to go. Thank you so much for coming in.
Thank you for having me, Tim.